Goodness. Oh, everyone, this is really exciting. Welcome to Doctors in Demand. Today we have Amira Posner, who is a Canadian licensed social worker who works only with fertility patients. So if you're in fertility care, or you're thinking about going through some kind of treatment, or you've been struggling a long time, this is a really good show to listen to. Thanks, Amira, for coming to talk to us today.
Thank you, Kara, so much for having me.
Well,
I'm
this
really
is
happy here.
this is a really, really important topic that comes up with so many of our clients, because no matter where you are in the world, no matter where you are in your fertility journey, there is some struggle or some mental health challenge. And so I want to jump right into it, because we were talking about IVF clinics mandating therapy, which is really awesome. So when I first started this work, the only thing that was offered, there would be sort of a counselor or a therapist, and it was only to walk people through self-injecting and the needle fear of needles. That was it. That was all that was being talked about as far as mental health here in the States with IVF. And okay, I'll admit I'm an acupuncturist who's terrified of needles. So that did make a bit of sense, but it really wasn't the whole thing. So I love that clinics are really acknowledging the role that mental health has in dealing with infertility in general. So it's really nice that these partnerships exist. So can you tell me a little bit about the type? It's not sort of like everyone going through IVF or fertility treatments that is required to do a counseling or therapy visit. So can you tell us a little bit about what's going on there?
Yeah, so it's really different clinic to clinic, but there are a couple clinics here in Ontario, and one of the things they do is they want every individual or couple who go through IVF to meet with a counselor to just help prepare them for the IVF specifically. So that's kind of unique. There's
That's
us.
amazing.
I know. There's one clinic here too that requires everyone who goes through just the investigative cycle to see the counselor.
Really? I want to stop there, and then we'll get to the other, the donor and all that. We'll get back to that. That is not something I see in the States. So I wonder, it's such a brilliant idea, but I wonder what instigated that policy. Do you know?
I find it really unique. And at first I was kind of thinking like, I don't know how this is going to work, because like these people have just started. They don't yet have a diagnosis. They're going through their investigation and they don't really know what direction they're going to take. So, but then after I started seeing these couples, I was thinking this is really beneficial because it helps to kind of go down different pathways and sort of foresee how things will come up and what they can do and deal with it. Yeah.
So that's really, so how do you start a typical conversation? I can imagine these couples show up and they're sort of like, what am I doing here? Often I find that it's the first health crisis for a number of people that we work with, where they're generally healthy people and all of a sudden they have infertility and they're sort of saying, why me? What's going on? And they don't necessarily have therapists that they've used in the past. So it's I would imagine you'd get a lot of people who are sort of like deer in headlights there. Like, what am I getting myself into? What's happening?
Yeah, it can be really, really scary, and especially for those who are struggling with secondary infertility. And going through all the tests and so much uncertainty and just not knowing what's to come. And then, realizing maybe there is something that's, wrong with your body, and navigating all the different emotions can be really heavy.
It can. That's really quite interesting about that. So you find that it's the women who had maybe an easier time with getting pregnant the first time or the second or the third, and that those couples come in and they're especially sort of, what's happening here? Why am I at this juncture in my life?
I think both, like primary, secondary. I think like although the journeys are different, I think the motions are very much the same. Just why is this happening now? And then for someone with primary, like, why is this happening to me? And so I run a support group actually, and I mix both like primary and secondary. And like 10 years later, it's never really posed an issue. So they all seem to support each other and really hone in on the fact that what they're experiencing in a common way are the emotions, and just helping each other through that.
That's probably really nice to not feel so alone.
Yeah. Yeah.
And what are the other, to jump back to, the sort of required or mandatory, like you sort of must meet with the therapist before we can move forward with the donor eggs or something like that?
Yeah.
Are those the same requirements that
Yeah. So those
that you're
are
talking about?
exactly, and every clinic will have that requirement. And
Mhm.
if you're using an egg donor or a sperm donor or a gestational carrier, in all those scenarios, you would meet with the counselor and help sort of prepare yourself as best as you can, from like selecting the donor to the journey.
Because a lot of things come up with this. So can you dive into a few of the, most common things you see, as far as, it's no one wants to get pregnant and decides, oh, I'm just going to go do a donor. If you don't have the right parts, right? You're like two men, two women, whatever it is, then of course we're looking at a donor situation. But infertility patients who end up at a donor where they didn't expect it, it can be really complicated and hard on the couple, and a lot of things come up. So I'd love to hear your insight on that.
Yeah, so it's definitely brings up different feelings. And I would say for most, it's a process, right? And it's a process of like grieving and letting go of, I guess, what they had thought would be and the way they envisioned having a family, and then bringing some space so that they could create their family a different way. And most often when someone is told in the doctor's office that for the first time that that would be their best option, it can be really shocking. And, you know, not to want to do it at that point is very normal. And then, just taking a step back and thinking about it in different ways. And that's why they do the counseling, to sort of help educate as well, because there's so many parts of donor conception that most people don't think about. And they certainly don't think about it when they're told that minute, you know, this is the path you need to take, right?
Yeah, it's interesting. A patient recently in my office here in Connecticut said to me, I actually can't go ahead and sort of purchase the donor. Cohort of eggs, actually, we're talking about, and before I meet with the counselor, which is silly because the counselor is just talking about how I would tell this potential child in the future about this donor situation. So can you talk about that? Like, what is that conversation?
Yeah, and it's hard for a lot of these couples to really imagine, right? Because it's going so far into the future, and after going through loss and failure, and now here we're talking about a child and what you're going to tell them. So it's about, having them sort of project to that stage and imagine, actually not even so far, but as, getting pregnant. And, I always focus on the fact that it's their body that builds the baby. These are like microscopic pieces that you can't even see unless you're looking under a microscope. And so the journey changes, and, you kind of restore that confidence in your body through the pregnancy process, which is what I've seen. And then you have this little baby, and a lot of the donor conception stuff kind of falls by behind, and you're so elated, but it's also very important to be open and honest and transparent in a very child focused way. And so that's kind of what we talk about, how to dissipate that conversation and when to do it, and how to how it changes over time, and the impact on self-concept and identity.
And is there a generally accepted path forward there? Or is it sort of everyone decides themselves how it's best?
I think generally individuals and couples are open to hear what I have to say, and I talk about some of the research, and I don't judge, and everyone can do as they please. I just think, nowadays in 2023, like there's so many ways of finding out if you used, donor sperm, and let's say that child got to be an age where they never were told, they didn't know, and then they did one of those over-the-counter DNA tests.
That's a thing. That's a real thing. I will tell you, I have had patients find out one of their parents is not their parent. I have found like people who think they're Italian and they have no Italian, like just these things that are identity breaking things. You have siblings you don't know about. Like this is real stuff that happens to real people with those tests. So that's a good point. What does some of the research say? I'm sorry I'm diving into this, but I find it so intriguing, because it's a newer thing happening in the fertility world. So what does the research say come up as the issues for these children?
Yeah, I mean, it's very clear, like telling them from a young age, without not having secrets, and obviously just defining in a term what the donor is going to be for you, and like that's not the parent, that's not a friend. It's just a little tiny piece of who this person is, right? So helping them understand that as best to your capability. And the earlier you tell them, it's just part of who they become. It's embedded in their self-concept, as opposed to waiting until they're 12 and you think, okay, well, now they're an adolescent and they'll better understand. That's not necessarily the case.
And just so many people come into the world these days with just this exact scenario where it's not necessarily the people you think of as your parents, necessarily share that DNA with you. It's just a really, it's a modern world we live in, right? And we're using a lot of donor sperm and egg these days. So it has to be very different from the psychological effect of an adoption, for instance, on a child. Is that correct? Like it's a totally different thing.
Yeah, it's different. It's very different. I mean, now they actually have embryo adoption. Right? So they all have similar kind of roots, but they're different in their own ways.
Okay, great. So back to this general situation of, okay, now I'm going through fertility treatment and I've got my medical appointments and my blood draws and my ultrasound, all that stuff set. What would you encourage? Because some people just go through it and they don't, unlike that one clinic you have, it's not in the checklist. I like ordered my medications. That's all in the checklist. But the therapist just isn't necessarily, and it's so important. So what can you say to someone listening who's in this and about to start a cycle and thinking, do I need a therapist? Like I've never had a therapist, or I'm not having stress or anxiety right now. Like what would you say to that woman listening?
Like, you're not alone. And actually, that's not the case. I get so many calls every day from women struggling emotionally. It's like they're at a place in life where they just don't know what to do with themselves. And so it's really sad. And here in Canada, the statistics are 1 in 6. So I think I would start by telling them that amazing that you reached out. Like that's a form of self-care. And this is your first step and you're not alone. And I often encourage the clients I see to really take things in small increments. So we can't look at the treatment like all as a whole. That's just way too overwhelming. We go to the end. What if it doesn't work? That's overwhelming as well. So let's be where we are, right? Let's start at the beginning and just take it in small increments.
Yeah, so I love that, and the having someone on your team who's actually a trained therapist, licensed therapist, who you can bounce off issues that arise to is just invaluable in this process. So, the work you do is so important, and it's not part of the package in our minds, but what's the harm in establishing that relationship is sort of what the conversation I have with women, because things do come up, and often it just doesn't go exactly how we think. It's like, oh, I was delayed, and then they changed my meds, and then this happened, and then this happened. There's a lot of area where we have to pivot, and sort of just your stress coping mechanisms themselves. This is a great place to dive into it. So this kind of work is so important, and becoming more of a thing we talk about. But it's just, how do we yell from the rooftops and kind of get everyone on board? What do you think? Any ideas?
I think it's becoming more prevalent, and, people are starting to look at fertility holistically, and there's more resources out there than ever before. I think there'll always be a private element to it. And in different cultures, even more so.
Yeah. And it's, I think part of it is that we think we're in this for a short time, because we sort of have this like, okay, 1 month, 2 month, we're always thinking of, the due date of the baby is what we're thinking about. And we're not necessarily trained to think about like us in the process, because it does seem like this step, this step, this step, this step. But it's just so healthy to have that person to bounce ideas off of. And I do find that people say, well, I, have my sister, and I have my mother, and I have these awesome friends. And, people with great support networks still struggle going through this, because it is, like you said, that sense of self-worth, or that, whatever, how you deal with disappointment, it can be, deep rooted from childhood. These things all come up, and there's not a way to capture that in the IVF clinic. Like, it's not talked about. You're just there for procedure, blood work, the medical aspects. So really important work you do. Anything else you want to just share with our audience, Amira?
No, I'm really passionate about this work, and there is a life on the other side of infertility. And just because your journey's been as long as it has been, it doesn't mean it's going to be so much longer. And I've done a lot of writing. If you want to check out my website, I also run a support group online.
Yeah. And so you work with individuals and you do group work online. And so we'll have the website underneath here for people to find you. Thank you, Amira Posner.
Thank you so much
for taking the time to talk today.
Amazing that you do this show. Are those lotus flowers behind you?
They are, some of them are. There's California poppies in there too. There's just a lot. It's a big wildflower kind of situation. It's kind of nice. Makes me happy, because I'm inside, I'm in my office, so I feel like I'm a little outdoors over here. Have a great one. It was so nice to connect with you today.
You too. Thank you so much.